Hello everyone, welcome. So today we will be discussing on what I call it self-diagnosis of anxiety. So it's more like, do you have anxiety or are you just very worried about things? So I would list a couple of symptoms that is expected to diagnose anxiety. So if you find that you have some of these and they've been recurrent for a couple of months, it could very well be that you have anxiety. Then we would also list like self-help practices to overcome such anxiety. So the first one is feeling nervous, restless, or tense, and is a persistent, recurrent feeling. And after a while, you can't even put a finger to what is making you feel nervous, feel restless, feel tense. Then the second one is having that sense of impending doom, like something wants to happen. You wake up and you're so worried about the day, thinking what does this day have in store for you, and there's that trepidation of just facing the day. That could very well be a symptom of anxiety. Then the third one is clinically, they will say your heart rate is high. You've gone to the hospital and they say, okay, your heart rate is high or it's fast. Or if you're someone who is a bit medically inclined and you used to know that your heart rate was around 60, now you check and you're having 120, you could very well have an anxiety ongoing if you have all of these other isolated symptoms. So not just that you have only increased heart rates alone, there are so many other things that can cause that. But you're feeling very restless, intense, it's been ongoing for months. You wake up with that feeling, that overwhelming feeling of an impending doom, and it's also coupled with your heart rate being very fast. Something could be going on. Then another thing is people who are anxious, they breathe very rapidly because the stress hormone, the adrenergic hormones, the fight and flight hormones is flooding the system. They've tricked the body into thinking, okay, we're either in fight or flight mode. And those hormones are flooding the system. It increases their respiratory rate, it increases the rate at which their heart will pump blood. So the heart rate also goes up and their respiratory rate goes up. There's increased sweating. The place is not hot and you are just drenched in sweat, or you are having tremors. Your hands and legs, they are vibrating violently and you cannot stop it. You are trying to hold a pencil and you're really shaking vigorously, and you do not have all those tremors of senility. I'm talking of a younger person now who has those violent tremblings that they cannot stop. It could very well be a symptom of anxiety. Then feeling weak and tired without even having done anything. You are just profoundly weak or tired. It could also be a symptom of anxiety. Then if you have trouble concentrating or thinking about anything other than worrying, you say you want to just focus on something and you find it difficult. Your mind is just ruminating one worry after the other and you can't even concentrate. You're watching a movie and you have spaced out in worrisome thoughts. You're reading a book and you have spaced out in worrisome thoughts. By the time you go from page 1 to page 12, you didn't even know how you got there because your mind was overwhelmed with a lot of worry and anxious thoughts. It could very well be a symptom of anxiety. Then another symptom of anxiety is having trouble sleeping. That is like one of the very alarming symptoms. Trouble sleeping, you just cannot shut your eyes down, you can't shut your mind down. That could really be a symptom of anxiety. Then some people have GIT symptoms. GIT, I mean gastrointestinal symptoms. They have running stomach without a pause. They get an alarming news and the next feeling is, let me just go to the toilet. Or their tummy is persistently running. You do not have an infective diarrhea disease. You have not eaten anything that irritated you. You are anxious. Your heart rate is fast. Your respiratory rate is fast. You find that you cannot sleep and you still see that you're going to toilet very often. It could very well be a symptom of anxiety. Then inability to control your worry, I've said that. Then now having the urge to avoid things that trigger anxiety could very well be that. If you find that, okay, I call this person, I get a knot in my tummy, my heart races, my breathing becomes very fast, and that same night I find that I cannot sleep, and you now say, okay, when this person calls me, I'm not picking up. It could be that you have anxiety related to that. Or someone who is agoraphobic, you go to crowded places like churches, lecture halls, and you find that once you are there, you are sweaty, you are panicky, you are anxious, your heart is racing or skipping several beats. you are aware of your heart beating, it could be that that person is avoiding such a trigger. So that could be a form of anxiety to crowded places. Okay, so someone who then identifies and say, okay, I have like 4 or 5 of these. Now, how do I help myself before I carry myself to the hospital? The first thing is to learn to practice mindfulness. What do I mean by mindfulness? You learn to be aware of what you are doing in a particular moment. If I'm eating, all my focus is on that food. If I'm brushing, all my focus is on that brushing. That way we limit the number of extraneous thoughts, irrelevant thoughts occupying mental space in our head. Another definitive way of practicing mindfulness is mindfulness meditation. I think you should check that up on YouTube. You'll find a lot of guided meditations that should help you. It's been found that if you can even meditate consistently, your anxiety symptoms will go down on its own. Now, there are two arms of our nervous system. There is the sympathetic nervous system and the parasympathetic. The sympathetic is like the one that fires our system up, makes you alert, makes you awake, makes you really, really ready to go. So I would call that the fight and the fight response. Then the parasympathetic are the calming ones, makes you calm, helps your digestion to work very well. You're able to relax and sleep, and a couple of other things. So meditation increases the hormones. If I want to just make it very easy for those who are not medically inclined, increases the hormones that are related to the parasympathetic nervous system. So it calms you down. It forces or trains your mind and your body to relax. Then it's also been found that it will ultimately increase your focus. Then you're more aware of your thoughts. Not that thoughts are occupying space in your head and you don't even know where they came from or what damages they are doing. So meditation will force you to really be conscious of your body, the sensations you feel, and even the thoughts that are going on in your head. So practice meditation. Another act of mindfulness is journaling. Journaling is just learning to write. You write your feelings, you write your worries, you write your plans, you write your agendas, you write your dreams. It's not so easy to be writing and be worrying at the same time. I don't know how you can be writing something and still be thinking of another thing. So journaling, intentional journaling, if done consistently, is also a way of calming the mind down. At least the duration you spend journaling, you would have also given the mind some breathing space. Instead of having 20 thoughts in 1 minute, it's just one thought about that plan I'm writing. It's just one thought about that feeling I'm trying to process. So someone who is considering journaling, you would plan a consistent time. If you want to do 20 minutes a day, whatever you feel in that moment could be something you start with. Or something that happened and triggered some feelings of anxiety in you could be something you start with. You write what happened, what you feel about it, with or without what you will now do about it. Even the act of putting your emotions on paper reduces all of these feelings of anxiety associated with it on many occasions. Then another thing you can do is practicing deep breathing. Many times, many of us breathe, we are unaware, we just know our body is working. Deep breathing, you breathe in that you will feel that your tummy is moving for every deep inhalation you take. If you inhale, you feel that your tummy is moving, and you do that consistently. So say someone is seated, has a tight knot in the tummy, the heart is racing, finds that the breathing is very fast, is feeling restless, is feeling anxious, is getting really worried. So such a person sits, closes the eyes, and takes a couple of breaths. So could just be like 20, just to recalibrate. You can even practice it. I tell you, it makes you feel better. You can just practice like counting 20. You feel better in the interim. So you can commit to doing like 20 in the morning, 20 in the afternoon, 20 in the night. You also reset the workings of the body. So that's another thing I would advise. Then dietary adjustment for those who take caffeines. Caffeines, we know coffee, caffeinated beverages, those who can take 2 bottles of Coke and they also have anxiety symptoms. That is like undoing the symptoms. And those who take bitter cola can take 4 bitter cola and still have anxiety symptoms. That is like undoing yourself. So if someone finds that, okay, I have anxiety symptoms. Then I check what it is I consume. Caffeinated beverages, caffeinated drinks should be removed or eliminated completely. Cola nut, bitter cola, those who take like 4 sachets of Lipton and the likes, those are things that contain caffeine. Then another thing is to practice structured problem solving. There is an issue that gives you a concern that has come to the level of an anxiety. Practicing problem solving, constructive problem solving is, okay, so this issue, what can I do about it? What can I not do about it? The fact that you are directing the energy spent for worrying into solving the problem on ground many times diminishes the anxiety symptoms. It's not just thinking of the problem, which will not get anybody anyway, but having some constructive plans to say, okay, now this has happened, and this has happened, and this has happened, and I will do this to change it, then probably do this, or probably do this, even if it is with the attempt of changing it, even if it doesn't end up changing the situation, at least it has redirected the thoughts and redirected the focus towards something positive and constructive. Okay, then cognitive behavioral therapy and learning to challenge negative thoughts. Every feeling will start as a thought, and every feeling will drive a behavior. So cognitive behavioral therapy is learning to think positive, beneficial thoughts. If just wherever you are now, imagine that you're thinking that someone is coming to rob your house, God forbid, bad thing. What feeling does that bring up in you? You're a bit anxious, you're a bit worried, you have some kind of tight knots in your tummy. What behavior will that bring up in you? You are planning to safeguard your house, probably put some more locks in place, get a dog, get a security, as the case may be. How did all of this plan start? It started with just a thought. So many times, before someone starts to have anxiety symptoms and anxiety feelings, it starts with non-beneficial thoughts. So the place of cognitive behavioral therapy is to examine your thoughts and see if they are all wholesome or they are not wholesome. Unwholesome thoughts would always produce negative emotions. Negative emotions will many times produce negative physical manifestations and negative behaviors. So the place of cognitive behavioral therapy is issues would keep happening till tomorrow, but what thoughts would I choose to have around it? If it's a negative thought, it should be that I'm planning to do something positive about it. If I do not have a plan to do something positive about it, then I may, of course, remove that thought and put another thought in my mind. We can control our thoughts. Many times people just think thoughts come up. If you are aware of it, you can control the thought. Common thing, another example is you already have it in mind that somebody is not a very nice person, and you say, no, I have not even met this person before. Let me give her a benefit of chance. She may really be a nice person. Have you not changed the thought? You have changed the thought. The negative feeling that you had from the initial thought is probably gone. So you have a neutral feeling. And I tell you, if you meet that person, chances are you will see that the person is really a good person. Versus you have said this person is not a good person. You have set the person up for failure, and you have set up the interaction up for failure. So little wonder the way we think determines the way our life goes. You know that saying that says, as a man thinketh in his heart, so is it. So cognitive behavioral therapy requires us to be aware of our thoughts and only leave space for positive thoughts that will give positive feelings and, of course, positive behaviors and manifestations. Okay, so the fourth one now, someone who has done all of these ones and see that my anxiety feelings are not going, there's place for medication. So that will require the person to find his or her way to the hospital, be assessed and diagnosed by medical personnel, and of course medications will be prescribed. Then I also forgot to add, exercise would also help. Exercise helps with anxiety. So if someone who is a bit sedentary, is seated on the chair 12 hours attending to businesses, customers, and all what's not, incorporate exercise into your day. I would recommend a simple routine of 30 minutes 3 times a week, and it should make you sweat. So if that would be jogging, that would count as that. If that would be lifting weights, that will count. Then when your jogging does not make you sweat again, it means your body at least has acclimatized to that. So level it up again. That 30 minutes, I'm setting a timer to get an any form of exercise done. And by the end of that exercise, I have produced some sweat. That's the simplest way I can explain what that exercise looks like. So 30 minutes, 3 times a week, you can scale it up based on what your schedule looks like and your tolerance level. Then those who drink alcohol and use recreational drugs, because one way people self-prescribe, self-manage anxiety is to drink alcohol, because alcohol has a calming effect. So there's something that has happened at work, you are very pissed off about it, you are very restless, or there's some financial challenges that gives you a lot of concern on how you're going to get around it. So the average person who is not clued as to how to get out of it will say, let me take a bottle of beer. It will calm you down, but it will also undo it's also like an undoing of your own recovery. Because when the alcohol or the substance of abuse leaves the system, the anxiety symptoms will come back with a vengeance. And if it is even an issue that needed to be constructively addressed, you have only just postponed it. When your eye clear, the issue is still there and still needs to be resolved. So using alcohol, recreational drugs to manage anxiety is not beneficial. It is more risky than of any benefit. Okay, so I think by and large that may be all I have to discuss today. So until next time, please stay sober. Bye.